Okay, I want you to picture this. You step outside, no sunscreen, no hours baking on the beach, and boom, you're golden. Deep tan, protective glow, and wait for it, a little extra libido boost. Sounds like sci-fi, right? But that's exactly what Melanotan II promises. They're calling it the Barbie drug, the tan in a vial, even a fat loss hack. So here's the million-dollar question. Is it a miracle peptide, or is it just another sketchy, unregulated trend? Today we're peeling back the curtain on Melanotan II, what it is, how it works, whether the libido hype is real, and the safety red flags. And ultimately, is it worth your hard-earned cash and risk? Stick around because by the end, you'll know exactly whether this peptide is the golden ticket or a sunburn waiting to happen. Let's dive in. So what exactly is Melanotan II? At its core, it's a lab-made cousin of a hormone your body already uses, alpha MSH, alpha melanocyte stimulating hormone. Normally, alpha MSH tells your melanocytes, the pigment-making cells in your skin, to crank out melanin, the molecule that gives you the brownish hue after a day in the sun. Melanotan II, it's like alpha MSH 2.0, stronger, longer lasting, and patented for tanning. Originally, researchers thought, hey, what if we could give people some level of protection from UV radiation without burning? The dream: reduce skin cancer risk by boosting melanin without endless sunbathing. But along the way, folks noticed side effects, libido spikes, less appetite, and even reports of fat loss. Cue the internet rumor mill, and suddenly you've got a peptide that promises a triple win: tan, libido, fat loss. But spoiler alert, science doesn't always read Reddit. So let's geek out for a second. I promise I'm going to keep it digestible. Melanotan II binds to melanocortin receptors. Think of these as locks. Melanotan II is the master key. There are 5 receptor subtypes, but the big 3 for us are MC1R on skin cells. These boost melanin and give you that protective tan. MC4R in the brain and reproductive tissues, linked to sexual desire and satiety. And MC3R in fat tissue, thought to influence energy balance and fat burning. So when you inject Melanotan II, it latches onto MC1R and MC4R and MC3R, setting off a chain reaction. The tanning effect shows up in days. Usually you see a baseline tan and then with small sun exposure, a deeper tone. And for libido, MC4R stimulation can increase sexual arousal threshold. Users report spontaneous erections within 30 minutes to a couple hours. And finally, MC3R activation might shift your metabolism. Some folks notice subtle appetite suppression or slightly faster fat oxidation, though that's the trickiest claim to pin down. But here's a handy analogy. Imagine your skin tone is a light bulb on a dimmer switch. Normally the dimmer goes up only when you get sun. Melanotan II, boom, it turns that dimmer up a notch. So a little sun equals a deeper glow. But remember, it's not a sunscreen. Some UV exposure is still required to fully develop the tan, and you risk damage if you crank that exposure too high. Okay, so let's cut through the anecdotal noise and look at the literature. So first, tanning efficacy. Multiple small trials have shown how Melanotan II can increase melanin density and reduce UV-induced erythema, or redness, in human skin models. Real-world users routinely report several shades darker after a few weeks of low-dose injections plus minimal sun. Next up, libido. So research indicates MC4R agonists can influence sexual behavior pathways. There was even a phase 2 trial of a related peptide, PT141, for sexual dysfunction. People reported improved sexual desire, arousal, and satisfaction. So yes, there's a mechanistic basis. Though most Melanotan II data here is still anecdotal, drawn from user forums and small observational studies. And fat loss? Here it gets a bit murky. A handful of rodent studies suggest alpha MSH analogs can upregulate fat oxidation enzymes. In humans, some users swear they're less hungry and notice inch losses, but high-quality clinical trials are lacking. So at best, promising hints, but no blockbuster data. And in terms of safety and regulation, here's where the red flags fly. Melanotan II is not FDA approved for any use. It's sold online as a research chemical. That means no standard dosing, purity, or sterility guarantees. Reports of nausea, flushing, spontaneous erections, and more worryingly, newer changing moles and freckles. Some experts warn that artificially ramping up melanin pathways could, in theory, promote melanocyte proliferation, potentially increasing melanoma risk. And in terms of long-term studies, we don't have any. So the bottom line, it works for tanning, libido, and fat loss, maybe. Safety, unknown. So here's how people are dosing it. Most folks do subcutaneous injections, think insulin style, into the fatty layer under the skin, usually around the belly. And the typical starting dose is 0.25 milligrams 3 times a week, increasing gradually to 1 milligram once the tan baseline is set. Microdosing protocols have emerged, tiny daily doses to minimize side effects like nausea or flushing. They'll combine it with short bursts of sun or tanning bedtime. just enough UV to activate the peptide without burning. Some users say they'll hit the beach for 10 minutes, then they're golden all week. And yes, the libido lift shows up at similar doses. People report increased interest in sex within an hour of injection. But remember, that's purely off-label and anecdotal. And a quick caveat, this is not medical advice. You want to talk to a licensed physician before experimenting with research peptides, especially if you have skin cancer risk or hormonal conditions. So every treatment has trade-offs. With Melanotan II, the most common side effects are straightforward. The first is nausea, often mild but can be intense, so people start low and build up. Number 2, facial flushing, like a hot flash that lasts a few minutes. Third, freckles and new moles. Yes, your body might sprout extra spots. And lastly, spontaneous erections. Cheeky, but real. Now, the more serious questions, long-term safety is uncharted. Increasing melanin via an exogenous peptide, sequelae, unknown. There have been isolated case reports of new melanomas in Melanotan II users, but causality, we just don't know. And animal studies hint that overstimulation of melanocortin pathways could affect cell proliferation. And quality control. Since it's unregulated, you have no guarantee of what you're injecting. Contaminants, mislabeling, these happen. Sterility issues can lead to infections. You're essentially buying a chemical from some random lab and putting it in your body. Proceed with caution. So let's stack the pros and cons. Pros, a deep lasting tan without hours in the sun. Reduced sunburn risk. And this potentially lowers UV damage. Libido enhancement, if you're into that, and possible subtle fat loss or appetite modulation. The cons, it's not FDA approved. Legality and quality concerns exist. Next, nausea, flushing, and potential for painful side effects. Third, new freckles, moles, or uneven pigmentation. Fourth, unknown long-term melanoma risk. And lastly, cost. It can run anywhere from $50 to $100 a vial. Repeat prescriptions add up. So who might consider Melanotan II? If you burn in minutes, hate wrinkles, and don't mind taking a research peptide under your doctor's guidance, maybe. If you're chasing a quick tan for a wedding or photo shoot and can stomach some side effects, sure. Who should steer clear? Anyone with a personal or family history of melanoma, atypical moles, or skin cancer risk. Pregnant or nursing women, no way. And folks with hormonal issues or heart conditions, probably best to avoid. Ultimately, it's a personal calculus. How much tanning convenience is worth possible health unknowns? So does Melanotan II live up to the hype? In the short term, yes. You'll tan faster, you might feel a libido lift, and maybe even curb your appetite slightly. But the long game, it's a gamble. We just don't have the safety data. We don't know what decades of melanocortin overstimulation could do. If your primary goal is sun protection and anti-aging, safer routes exist. Broad-spectrum sunscreen, topical retinoids, antioxidants. If you're desperate for that golden glow and okay with taking a calculated risk under a physician's watch, fine. But go in with eyes wide open. It's a tool, not a miracle, and certainly not risk-free. And as always, I thank you so much for tuning in. I hope you enjoyed the content. If you want to go ahead and hit like and subscribe or leave a comment, I really appreciate it. And I look forward to seeing you in the next one. Thank you.